Well, good morning, everybody. It's so scary to be between you and lunch. So, my name is JD Buchert. I've been in healthcare for 38 years. I know it doesn't look it. As I said before, I used to work in plastic surgery, and I'm married to my husband of 30 years now, who demands that I use a lot of products. But I want to speak to you. The reason that this topic became so important to me is my husband and I adopted a 15-year-old transgender who was brutally abused by her family. And so, as she said, she woke us. Because I really, up until that point, didn't really have the knowledge of transgender care, especially in the perioperative setting. So when my journey started, it was with my daughter. I do have a picture of her in the presentation. So, but let me tell you a little bit of something else. I was a combat nurse. I was retired from the military. I was in the Army for over 20 years, and then I went to the civilian healthcare center. Oh my gosh, what a difference. So, but the one thing that really opened my eyes is that the need for our community. It's a totally different need in the military. In the combat zones, I was in 16 combat missions. And then coming into the civilian factor, where you're seeing more traumas. And you're seeing more factors of what our community is facing. And one thing that I was really brought to today that I got a little bit more of is the health insecurities that our communities are seeing. Right? So that's how we kind of start this. This is a topic, and I promise I don't have any sort of conflict in relation to this. And then there's my mall picture that I went and took. I actually took it on a cruise ship and did all that. Actually, I hold two roles. I'm still in the perioperative setting, but now I've taken on a directorship of workforce safety. And what that is I really focus on workplace violence prevention. I'm one of only 4 positions in the United States that actually focuses primarily on workplace violence. And I'm very excited about that because I always say I'm a nurse's nurse now. I gave 35 years to caring for our patients. Now I get to care for the amazing people that care for our patients. So these are the outcomes that were going on here, but I want to tell you a little bit about my facility. You know, at Parkland in Dallas, Texas. So we're committed to embracing the diversity and ensuring that every individual feels respected and valued. So today we're going to discuss how our mission-driven work and the strategic priorities and even the core values are aimed at fostering and welcoming environments for all. And somebody's got to teach me how to do this. I have my notes on here, you guys. I'm so sorry. I'm going to try to make this go right. Let's see, I already did it wrong. All right. So the purpose of the pathway are clear, and we want to provide exceptional care, as we all do, and support to the members of our communities, right? So we meet with the people and where they are right now. We recognize that we do not have all the answers, right? We really want to make sure, as we are all sitting here trying to garner more knowledge of how we can increase our opportunities to better support our communities. So at my hospital, we're also applying the best practices for the industry standards. And so with transgender care becoming a really new role and new environment, it's becoming more widely accepted. We wanted to make sure that we're addressing the care to our transgender population just as much as we're addressing the care to other populations that we service too, right? All right, now this button changes it. So these are my objectives, and today we're going to dive into the crucial topic of transgender inclusive care with significance in healthcare. We are also going to explore how clinical and business efforts can align and enhance the gender-affirming practices and how each of us can become allies in the journey. All right, so right now, there's an estimated 22,700 transgender people living in the state of Texas. And with about 29,800 of those between the ages of 13 and 17. So at my facility, as we do not do pediatric, we have about 93,000 people at the age of 18 or older that we have the opportunity to service. So, and what is this last one? It says 29% of all the LGBT adults in Texas are raising children that possibly have transgender opportunities. And as my daughter continues to woke me every day, I always say woke me, and so there may be some trauma-informed care language that I'm saying inappropriately, and I welcome anybody to check me on it. Please do. So I wanted to show you the diversity in the ages that we're seeing, and this is just from a 2021 statistic, and then also the races that we're seeing in this population. And as I'm in a very large metro city, I think it's the 8th largest in the country, we have a very large population there. So, and it's always very important that we all understand the definitions of the gender, the transgender, gender identity, and cisgender. And I'm not going to read this to you because I know that you guys are all highly educated. You can scan over there. So remember, I'm going to try to go through this because we started a little bit late. I'm going to be going rather quickly through this, but you can get these slides, okay? Please take this opportunity to utilize this and share this information with others. Here's some more: gender dysphoria, gender expression, gender transition, and sexual orientation. How many people, and I'm one of them, in the past really considered that transgender and sex were kind of in that same bucket? I was just as guilty thinking that everybody that was transgender had something to do specifically with their sexuality. I was that ignorant. And as I was married and my wife passed away, I came out of the closet 10 years later. I've been married to my husband for 30 years now. I still had that misconception of the transgender community, which I'm a part of. And it was a really sad moment, but as I always say, I adopted an incredible young lady that really helped me to see the world as it should be. So this gingerbread person is one of my favorite graphs. This came out of the Northeast. I don't know why, but I think it came out of Connecticut. So this is really cool. This gingerbread person, how I kind of identify this transgender role about how their expression and their identity is really part of this, and then sex plays a small, minute portion of that. But this other one from Dr. Wu is probably one of my favorite ones because it really starts to separate those two opportunities. So one is the transgender, that gender identity, where the other one is so often confused with that sexual orientation of that person. So I really want to make sure that you guys understand it is two separate things. So in healthcare, in the perioperative setting or the emergency department, we may be focusing on two separate things when we're on this. When we're looking at our community for the gay, lesbian, bisexual organization, you may be asking different questions when you are asking the transgender population. And I'm going to go into that too. But I want to set some ground rules and where I come from in my facility, because we had to set and establish ground rules for our 15,000 employees. So with this, we set the stage and we had the opportunity to go through this. How many people understand what HR is, that high reliability organization, where we kind of hold ourselves accountable? And so with that, we are now not holding that information inside. We share, we put everything out on the front porch to make sure, because knowledge is power. And so we set expectations also. So, but we also have what we call I-CARE values. And the I-CARE stands for integrity, compassion. I'm going to try to do this again with my little notes, see if it works. Hey, it does. Accountability, respect, and equity. That is part of our day-to-day requirements as a health coworker in our facility, I-CARE. But our HR journey also emphasizes several universal skills that is very important to us. I'm sure that you guys already know about this, the STAR method, or you know, that cross-check, making sure that somebody's backing you up on your information. What about three-way repeat backs? Everybody understand that? What about phonetic and numeric characterizations? Do you guys know that? When you're spelling something out, how we use that, I call it the military language, alpha, beta, Charlie, Delta. What about a warm handoff? Who has heard of SBAR? You're going to hear that a lot in this presentation. That's a situation, background, assessment, and recommendation. It's huge, and it's so very important, not only in our day-to-day operations in a perioperative setting, but also in healthcare itself. It sets us up for success. It gives us knowledge that we should always have. I think that, and then ask for clarity on questioning. So if you don't know, you're not sure, we always say that HRO principle of asking for clarity is going to be very important also. So let's get to the bread and butter of this presentation. So it's a foot in the door. 70% of all transgender patients are seen in the emergency room because they don't have insurance. So that's where the care usually initiates. And it's not because, hey, I need to go get a flu shot. It's because usually it's some sort of trauma that's happened or surgical need. So a lot of times in the OR, we're seeing those transgender patients coming in through the ED setting. And it can be both scary for us and for them, but also it becomes a really opportunity for eye-opening experiences. So when we're providing this DEI topic of choice at the ground rounds at our facility, we always focus on this LGBT and specific topics. And this one right here is, we have over 500 staff members that have taken this specialized training, and 50 people hours are given to our 15,000 employees every year. And one of the 50 hours that we require is for the DEI and transgender is built into that. Very cool. So one of the things that we want to do when we start to receive our transgender patients, we want to make sure that we ask about the name and the pronoun. I'm sure that a lot of you guys are already enlightened on that. I was not. I called Brooklyn the wrong name for many months before I realized that Brooklyn is her pronoun, is her name, and her. So if you're unsure about what name or pronoun to use, just ask. So, and you know, it's like, what pronoun do you prefer? But consistently use that chosen name and pronoun when you are introducing new staff. And how many people have Epic here? So Epic has the opportunity to update that information in there too. So you can have chosen pronouns in the Epic system. I can't speak to others, I just don't know. But you also can put that valuable information in there. Because we know legally when we have to consent somebody, we have to use that legal name, right? So that's part of our communication that we're going to also have with them. So we always want to use gender affirming language and develop a habit of applying gender neutral language to all the patients and their partners by embracing the use of gender neutral they. How many people have done that? It is the hardest thing for me to break. It really is, because being raised, they meant multiple people, right? And when I'm talking to one individual and I'm saying, you know, how are they doing today? And I would look back a little uneasy, I can tell you that. But it is an opportunity again for us to all grow. So, but we also want to avoid sexist, the sexist topics and such as like he, she. Sometimes it becomes a very uncomfortable situation. And so just putting it out there, sometimes it's very difficult for us to kind of go down that avenue, but it's okay. It is okay to make mistakes, just own them. What about when we are using our SBAR? My favorite thing, I use it in everything that I do, I use an SBAR. Let's identify that may be linked to their government IDs, right? So when we are doing those consents, we have to consent legally, so, or any sort of treatment. We got to make sure that we're linking that name to the government ID, but we have to explain to them and communicate gently why we're doing that. It is required by the government that we do this. This is a law that we have to follow. We are doing this for your safety. However, please know that we're going to be using your pronouns and what your preferences are in our day-to-day communication with you. That's important to them. Fill them in on any requirements that we may have. I am going way too fast on this thing. Okay. How about providing the appropriate confidentiality? How many people have heard that curtains have ears? Right? Good Lord. Try to say a cuss word in the OR that's or in the pre-screening rooms with those curtains. Made that mistake once after I got into the military setting. So anyway, transgender patients are at risk for assault and harassment consistently. So providing that safety and confidentiality is paramount. One reason for transgender patients feel unsafe in the emergency department is the fear that they may be outed. So they may be outed to their family, their community, or even the people in the waiting room that may threaten them. I come from a hospital that has the busiest emergency department in the country. And we see about 270,000 people a year in our emergency department. It's crazy numbers. So if you can, find a private space. If not, make sure that that tone of voice is just heard between you and them. Also ask permission to disclose their information. It's not automatically known, and sometimes that we are just going to do this. We got to make sure that they understand what we're doing with that valuable information for them. It's protecting their privacy. Be sensitive about the names that you use again. I just keep messing up this thing. Next time I'm bringing my paper notes out, y'all. So another thing is we want to make sure that we don't over-examine. Our own curiosity is the last thing that we need to focus on at that time. Avoid invasive physical examinations if possible, or offer alternate testing to these people. A vulnerability and a visible gender variant, a person may feel like they're being a spectacle. And so it's important to avoid further marginalizing of them. So, but we also have to make sure that we're open in communication. So let's set those expectations and standards with them right from the start. All right. There it is. As always, what we do in education is we're going to be open and honest, and we're going to explain what the processes are. We're going to address their concerns, and then we're going to explain the standards of our facility, and we're going to reinforce their safety. Right? Is that what we're doing with all of our patients anyway, correct? I mean, that's what way I see it when I go into any facility, and it's amazing the care that the perioperative staff always gives. But we also want to embrace the continuing of that medical education too, because there's opportunities, and many times our transgender population wants the opportunity to educate us. So when we have medical students or residents or care providers that are largely undereducated on transgender care, let's seek out further knowledge from the source himself, but let's respectfully ask. So what else could we do? Could we implement education into our own healthcare systems that supports not only our physicians and nursing, but all staff? That's why we built it into our 50 hours of required training a year. Transgender patients don't expect you to know to everything, so they are open to being asked questions. Please know that. That's one thing that my daughter taught me. Also, take their complaints seriously. Transgender patients are at high risk for adverse outcomes, so err on the side of caution. They face higher rates of substance abuse, mental health issues, and social issues such as homelessness and poverty. Often, they're on hormonal medications and have poor understanding of side effects. They may have unfamiliar surgical histories. And then all of these combine in the place where these patients are at high risk for adverse outcomes or have a serious or misdiagnosis. So display outward signs of acceptance also. At our facility, on our name badges, we do honor the he, she, him, or whatever that pronoun would be. We put those on our badges. We display within our healthcare facility that we are an open, honest facility, and we support all of our community. We have signage for multiple things, and it becomes very important for our patients to know that we are a safe place for them. signage, rainbow stickers, pronoun pins, all of these are important in letting them know. So what about the ethics that comes with this? It can be challenging for some of us. I was raised a really staunch Catholic, and I married another Catholic, and I can imagine that the challenges that may come into sometimes being in uncomfortable situations. But we understand that there are individuals that have their own ethics involved with this, and that is fine. We have to be upfront and honest with ourselves too. In an emergency situation, we're going to get the best care to our community. But if we have a choice and we are uncomfortable with that situation, and it's not a safe harbor situation, what we can do is we can speak with our leaders. If I'm uncomfortable but providing care to a transgender patient, there is nothing wrong with that. That's okay. One day you may seek that education that may strengthen that ability. However, there is also an opportunity to hand that off to somebody that would be willing to do it. We call them champions in our facility. We have champions that are specially trained to provide care to our transgender population. But they're also there to educate if you want education. We're not going to require all of our staff to provide care. We just want them to have the knowledge in case it's an emergency situation. All right, off my soapbox. All right, so we have about 30% that come through our clinics too. I was one of the, as I have a plastic background, I did a lot of reassignment surgeries or reconstruction surgeries. And so with that, we had our specialized clinic that our patients come through, and this is the process of our clinic. And this model represents the patients have decided to have the gender reassignment surgery. You know, it's a very complex pathway that the patient and the clinician must follow on this. And the surgery will not happen if these areas are not met. So the staff in this clinic are well trained, and they help our patients navigate this journey. So on the other hand, you may have that patient in that is transgender or in stages of transition that require other services, maybe ACL repair, maybe having an ENT procedure, something to that aspect, urology. I know I've had a lot of urology patients. And so something with that, if that team effort and that patient is there, we need to take the lead on that. And so going into that elective surgery, the surgeon should have completed the confidential history, H&P, and then be open to discussing the provider's office. So these uncomfortable conversations don't need to be uncomfortable. And that's the message that I always want to give out to everybody. It's not uncomfortable to my daughter when she's in there because she, like all of us, want to get the best healthcare, right? And so let's not make those conversations uncomfortable. It is just a matter of fact of what we're doing. And so the patient must come forth and be honest as well. And that's one thing that my daughter taught me. It's like, we got to be just as honest with you as you are with us. And I fell to the ground and thanked her. This is my daughter. So she's an amazing young lady. She is now finishing her master's. And I'm very proud of her. And that she is going into healthcare, and I'm very excited about that. So transgender patients may have chosen names and gender identity, which I've already gone over. And I want to make sure that we understand that we are creating a safe environment where patient is free to answer questions related to transgender status, the medical history, including the inventory of organs, their hormone usage, silicone and fillers. I mean, have you ever seen on the street where somebody has put a filler in that was actually the tire inflation foam? Yes, she comes to plastic surgery. I know that she probably would have. So it's scary, some of the things that we will see that the modifications go on because they did not feel safe going to healthcare. We want to make sure that we take that in. But smoking history is really important in this also, like all of our patients. Let's see if I can get this without going crazy on me. So during that physical exam, be cognizant of the proper pronouns. Again, I'm going I'm going to reiterate a lot of stuff throughout this process. But consider a chaperone if you're uncomfortable. There's nothing wrong with having somebody in there to chaperone you through the process. That's why we have champions within our facility also. So use the appropriate gender, the chaperone according to their identified gender. And always ask open-ended questions that should be led by our healthcares, right? Open-ended questions. We don't want those yes or no, or we don't want the head shaking. We want to make sure that we have that precise information. But what about room assignment? If you have the opportunity, we should determine early if the patient is going to be admitted to the hospital and where those rooms of the gender-based transgender patients should be assigned based on their self-identified gender. So consider a private room if available. And you know, right now in the United States, hospitals are designed to only have private rooms, but we still have some facilities that do not have those private rooms yet. So those are the things that we want to consider. And that's if they're available, because this is where interdisciplinary collaboration and that culture of safety for our patients and staff really starts to come into play. All right, so proper communication. We always want to make sure that we don't want to fish. Know the information that you need and ask directly. Be upfront about the reason that you're asking this question. So examples are the law uses specific words to decide who can make medical decisions on another person when there is no sign of medical power of attorney. Do we not use that already? What about, I need to ask some additional questions about your relationship to the patient to determine if the law allows us to accept medical decisions that you can make on this patient. Do we kind of ask that now in that significant other situation? So, and it's like, I apologize in advance that these questions may feel very personal. I will only ask you what is necessary under the law. One of my favorite statements. Social terms may vary. So be specific, but avoid legalese when possible. You are a nurse and the patient have the right to that intake assessment privately, you know, if it's not a minor. So reassure, you will only ask questions that are important to the procedure that they are consented for. So when in doubt, can you tell me more about what you mean by this? So if you don't have that knowledge, garner it. So, but always make sure that we use that gentle tone, and that body language matters also. A defensive body language can really be seen by somebody that's already on the defense. Right, so sit down at the bedside if you can, look them directly in the eye and give them the full attention. Know your own, and somebody had said the best thing about anything is listening. And I love that statement too, the best respect that you can give. It's okay to practice tough conversations. So if you, and then always know this, if you make a misstep, acknowledge it, apologize, and move on. That's the best advice that my daughter gave me. All right, so now let's hit this intraoperative setting. Caring for a transgender patient during an intraoperative period requires unique population-specific considerations because it involves the anatomical, physiological, and even the psychological, but also the pharmacological aspects. The anesthetic should be planned with careful consideration to unique findings during the perioperative workup. Perioperative staff should be informed that the patient refers of their preferred pronouns. What's the last sentence that goes away before a patient goes to sleep? Right. And they don't want to wake up to having that memory, right? So perioperative staff should also be informed of the patient's preferred pronouns and that these should be maintained throughout the perioperative period. During the first timeout, while wheeling that patient through the door, the circulator should make all introductions using the preferred pronouns name. How cool is that? We have implemented that now. That is best practice. Legal name can be used for the final timeout with the surgeon. As mentioned previously, privacy is important and efforts should be made to minimize traffic, cover windows, And even minimize that rotation of staff in the operating room, especially if that surgical procedure involves exposure with genitalia or chest area. So, as we are all nurse advocates, when making staff assignments, charge nurse or leaders should also give that circulator or the scrub technologist, I hope I said that right, so, the opportunity to decline an assignment. That's respect. We have to have interpersonal respect for our team also. And it could be due to personal or religious reasons. This shows respect to our staff as well. We are just speaking to our roles. And as leaders, we know in advance that this surgery is on the books. So what we want to do is we want to make sure that we are prepared. Now, like I said, 70% of our transgender patients seek care through the emergency department, and you may be coming up, but you still have that opportunity, usually in a red board case, that's what we call it, that an emergent surgery is coming up, that you could still have an opportunity to make sure that everybody has knowledge, right? I know I got some charge nurses in here. So we want to make sure that we avoid the abuse and bullying in our workplace, because it's always going to start with this. So avoid the use of inappropriate name, and it always becomes an educational opportunity, right? So be cognizant of the patient's feelings, fears, anxieties, and respect from the start to the finish, and minimize those side conversations. All right. Anatomical considerations. So if a transgender patient has undergone gender-confirming surgery involving the urethra, such as a vaginoplasty, a phalloplasty, a medioidplasty, or the urethral lengthening, placement of these urinary catheters may necessitate the use of a smaller catheter. So we have a transgender cart with multiple sizes of catheters on there. Always go with the smallest catheter first. It's very important information. And in most circumstances, a urologist or other practitioner experienced in transgender care may need to be consulted to place this Foley. So that's important information also. And so if you do these procedures in your facility, you should have specific cart stock, which I already said that. So in that opportunity. So transgender women may have completed a laryngoplasty or chondroplasty to alter their voice pitch. So risk of these procedures include vocal cord damage, reduction of tracheal lumen or stenosis, dysphagia, or even tracheal perforation. So these are really important details as we are directing our intraoperative airway management. So this is, where we put that trach pressure on there, make sure that we're straighten that out. Those are things that become very important for that circulator and that anesthesia team to really start to focus together on. So when we're doing the history of that patient, and we know that they're transgender, let's look at those procedures, that procedure history too. It's going to become very important to us to create a safer environment for our patient. So in transgender men who have not undergone gender-confirming surgery, we may have the breast binders or the chest straps are commonly used. And so while the literature is lacking, this can be potential pose a risk for respiratory failure, respiratory function due to their restricted purposes. So the provider and the team, this is where the education really starts to come out. We have to clearly explain to the patient that these devices should not be present during the intraoperative and immediate post-operative period. We want to make sure that they understand when they go home from this procedure that they're not able to utilize those chest straps. We've actually had patients that come back that have had difficulty letting go of that chest strap for that 30-day requirement. And then we had to take them back in for hemorrhage. So the education was not given. We want to make sure that we have an opportunity to make sure that we are advocating for all of our patients. And that is just one of those areas. But knowledge is power. I didn't know it. Did you guys know it? So in most cases, sports bras are used. And they have that, the compression garments, which I'm not gonna lie, sometimes are your best friend, right? Who doesn't want to feel tight and all that? But we also got to make sure that education is given us. We cannot do this, because if we have that compression garment over stitches, do you think there might be surgical site infection opportunities? Things like this. These are things that we need to start to think about to advocate for our patients. It's a whole lifestyle. I mean, I am still growing. So our inpatient, even afterwards, you know, not a lot of times, but you know, sometimes our patients, we're still going to follow them up, and we're going to give that transfer directly to the floor sometimes. I know that not all facilities have that opportunity for a PACU before they go up to the floor. So how many people actually have do their post-operative anesthesia care too? Anybody in here? I have spoken in the past where some nurses go directly from the start of the case in that pre-operative setting all the way through post-operative care. How would that be scary? And then they take them to the floor. It's usually those rural hospitals that we're seeing that in. So education becomes a big factor in this. So detailed SBARs are going to be very important for a vulnerability period of these patients, and it can impact the patient's ability to accurately confirm the medical history. So, and what's the big thing that we got to remember? Preferred names and pronouns, right? What about pain management? So pain management is important as it's a contributing element to the post-operative and chronic pain, which include that psychological factors, which a lot of our patients are facing depression, fear, and anxiety. And you guys all know I'm an aromatherapy guy, so don't think I'm not slapping a bunch of aromatherapy on my patients also. So other considerations include hormone-induced osteoporosis and previous surgeries, and even impaired immunity systems. These are things that we really have to start to focus on, because as circulators, we're very cognizant of advocating for all of our patients. So we want to make sure that everybody on the surgical team is aware of this. And 99.9 times they are, but we just want to make sure. It's like when my son, when he was being raised, I was a widower, and so I raised my son on my own. And as a parent, how many people say, "Hey, did you clean your room?" And then you go verify. That's what I consider it to be. I'm just verifying because I love you. Transgender community is at the highest risk for psychiatric morbidities due to depression and anxiety disorder, which can result in a poorer health outcome. It is important to have a holistic approach and consult mental health, social work, and even spiritual care to adjust the patient's specific needs and preferences. Patient privacy is preferred, but if there is not a private room, let's figure out a way that we can utilize an area to really better communicate with them. Transgender patients should have a room according to their gender, which I've already stated. And we also want to be, if a private room is not available, which I've already stated, I'm sorry, I might be repeating notes, so I'm just that good. I want to make sure I nail it. So, post-discharge. So a multimodal approach is always going to be the best thing on this. So, this is also going to include that non-pharmacological solution. I'm not saying always, it's not always going to be aromatherapy, but there are some non-pharmacological solutions. For the psychological pain therapies, we should be using this. We're also got to be cognizant of the high drug addiction rate amongst transgender patients. So this is why we really work and focus on that interdisciplinary team when we are providing care from start to finish. And finish is not when they leave the OR, right? So here's some more information. The population of patients are at higher risks for drug and alcohol addiction. There's counseling and social workers that can shine and find out what's hurting them. We call it trauma-informed care, because we all come from a history of trauma, right? So let's be specific of what is making people act and what their addictions may be. And then let's go from there. Transgender patients may have
have avoided healthcare due to fear of the stigma and discrimination, and this is leading to the health conditions that are not well controlled. Transgender patients living with HIV, for example, are less likely to receive antivirals and ultimately achieve a viral suppression. So to the point of undetection. So as seen in this graph, you're going to see that well-being really starts to play a role in what we do in our healthcare systems. But we got to improve the awareness and the staff training and the resident training. As I come from a teaching facility, anybody else a teaching facility here? So that's a huge opportunity for us there. Let's teach our young, I call them baby nurses, and I don't mean to be offensive when I say that, but let's teach our young, but let's also let our young teach us. And because we as veteran nurses do not have all the answers. That's why we're here, right? So let's integrate transgender inclusive best practices into the organization, including designing a healthcare equity index, communicate intention towards allyship. We have an allyship program that we have in our facility. It's really a lot of fun. We do 21 days every fall. It's like, instead of doing that Movember where the men don't shave for the whole month, not that I would never do that, but what we do is throughout that whole month, we have allyship day, and we have a new educational opportunity every day. And it really becomes quite fun when you have 15,000 staff members that are doing it at the same time. People start to check each other, and it's really cool what it brings up. So further efforts to necessitate and establish organizational standards for sexual orientation and gender identity data collection in services of excellence and in our patient care. So we're very fortunate at my facility. We have right now 112 transgender people that work for us. It's an amazing opportunity. I had no idea until I became active on our committee for this. And with that, it's really helped us become a community leader. And now we provide counseling, we provide medical care through our clinics outside of our facility. So we have a transgender clinic in our hospital, but we also have 20 other clinics that now we can provide care to our transgender patients. So they no longer just have to come to the emergency department. How's that sound? I do have some statistics that I want to share with my Connecticut folks. So if there are questions, please ask while I look at these statistics right quick for the numbers in your area. Here it is. That was too fast. So in the Northeast region, there's an estimated 61,700 transgender people. And in Connecticut alone, there's 17,000 transgender patients. So, all right. So these are quotes from two of my patients. While you guys read that second one over there, the transgender woman, I'm going to read the rest of that very long letter so I can share it with you. I did 3 procedures on her as she was transitioning. So when I began my transition in 2015, I was faced with the reality that I was going to be here and I had to stand up for as my own advocate. Since then, I've become an advocate for myself and others in my community. Parkland has taken all of my questions and concerns seriously over the years. Through speaking up at community events where Parkland has a presence, many departments have developed protocols for making sure that transgender healthcare is not only accessible, but desirable. There have been bumps along the way, yes, there have, but all in all, I have had many positive experiences. I continue to educate and encourage my providers and my nursing staff to anticipate the needs of the trans patients before they occur. I want to see Parkland as a healthcare system that creates the protocols from which our other hospitals can adopt. I asked my primary care physician one day, am I your first transgender patient? And she replied, yes, and it has been an honor to learn from you. It doesn't get much better than that. Here are my references. We developed a poster, and I just got the information that our poster will be displayed in Boston at AORN. I'm very excited about that. Yay!